Hey folks, going to talk a little bit about some of the things we actually do as neurosurgeons. This is a sample from a paper I wrote a while ago about doing surgery on a type of brain tumor called an intraventricular meningioma. The ventricles are fluid-filled spaces within the brain, and meningiomas are a type of brain tumor that can occur in these spaces. On the top row up here, what you see are samples from an MRI that show you three different views: axial, sagittal, and coronal of the MRI, with the white thing here being the brain tumor, the meningioma. And down below, what you see is actually a reconstruction of something called DTI imaging, or diffusion tensor imaging, where it maps out the white matter tracks that are important for certain types of brain function. So the key with these types of brain surgeries on deep central tumors is to avoid certain of these white matter tracks that are important for function. And this is a diagram also from a paper that I wrote about the positioning of patients for this type of surgery. Positioning is a complicated thing that it's almost impossible to appreciate until you've done the surgery, but it's important to position the skull in a way where you, as the surgeon, have the correct view of the entrance you want to make. And in this case, it's showing the nose up, and the patient flat on their back, so that you can access this posterior aspect of the ventricle, right? And so what you actually see down here is the surgeon's view, where we've opened up the skin, taken off a piece of the bone, and we can view the surface of the brain that we need to enter in order to perform the surgery and remove the tumor. In this diagram, also from one of these papers, you can see again the position of the patient up top, and then down here to the left, you see colored in purple the precentral gyrus, where motor function is located. Behind it, the post-central gyrus in green, where sensory function is located. And then this little white arrow shows how we're able to dive posterior to both of these in order to enter the ventricle, as you can see down here, in order to access this tumor. So these type of taking multiple things into consideration, the position of the patient, the location within the brain of important areas of function that you want to preserve when doing these operations safely, are examples of just some of the problem solving that you need to be able to do as a part of being a neurosurgeon and a brain tumor surgeon.